Good afternoon, everyone. Thank you so much for joining us today. Welcome to our expert panel on COVID-19 community questions. And this webinar has been made possible by a partnership between the Columbine Health Systems Center for Healthy Aging at CSU and CSU Extension. My name is Nicole Earhart, and I have the distinct honor of being the director of the Center for Healthy Aging at CSU. For those of you who are just being introduced to us for the first time, the center serves as a catalyst for interdisciplinary research and evidence-based outreach and education about healthy aging. And as a community engaged center, it's our goal to be a trusted resource for discovery and application of research during this crisis and moving forward. So we hope this seminar is helpful to you, and we would absolutely appreciate your feedback on the content and potential subjects for future webinars like this one. So we are thrilled today to have a panel of experts from a wide variety of different departments at CSU, as well as one of our special guests, Dr. Rebecca Jackson, who is a noted MD and specialist in geriatric medicine, to help you bring the latest science and to bring to you, anyway, the latest science and medical-based approaches in keeping you and your loved ones and the people that you're serving in your communities as safe and informed as possible. So I think all of us could say that the biggest challenge many of us have faced during this recent pandemic is just figuring out how to navigate the changing and conflicting information that's coming to us from different sources. And so added to this is the difficulty with balancing changing policy and guidance with preserving the vital relationships and services for older adults in Colorado. So we hope we can begin to help with that process today. There's a few housekeeping items I'd like to go over right before we introduce our expert panel. One, if you could all be sure to mute your microphones so that any background noise can be reduced. We are recording this event, so you can view it again, or you can forward the link to friends, family, and colleagues that might find this information helpful. And during the last few weeks, we reached out to various stakeholders in our communities to ask what questions you might have for the experts at CSU. And for those of you who did reply, thank you. We compiled that list and we are going to go through all of those questions. For those that are joining us that didn't have a chance to respond, you can ask your question in the chat function during the first portion of this webinar, and then we are going to go through as many of those live questions as time permits. I also just want to share that this webinar is intended to provide general information and discussion about health and related topics from our panel of experts, and that the information and other content that we provide here or in any linked materials are not intended and shouldn't be construed as personal medical advice, nor is the information a substitute for professional medical expertise. And certainly, as you know, your healthcare provider is the best person to inform you of your health risks and recommended behaviors during the COVID-19 pandemic, as they would be the most familiar with your specific personal health information. So I'm going to stop sharing the screen and then introduce the panel of experts. And as I introduce you, I was hoping that each of the experts could unmute and make sure that your video is enabled and just say hello so everyone can see your face pop up and that you can be recognized. So we have with us today Dr. Mark Zabel, who is a professor and associate director of the Precautions Research Center in the Department of Microbiology, Immunology, and Pathology. And he is the research associate dean in the College of Vet Med and Biomedical Sciences at Colorado State University. He earned his PhD in experimental pathology and microbiology at the University of Utah and did his postdoctoral training at the Neuropathology Institute, the University Hospital of Zurich, Switzerland. Mark, can you wave and say hello?
Hi, everybody. Can you hear me okay? Thumbs up?
We can, thank you.
Thanks.
Our next expert is Dr. Marissa Bunning. She is a professor and extension specialist in food safety in the Department of Food Scientists and Human Nutrition at CSU. One aspect of her research focuses on food safety communication, so she will be a key player in some of the questions that have been posed. Marissa, can you say hello?
Sure. Good afternoon, everyone. Really looking forward to talking with you today.
Our next expert is Dr. Deanna Davalos, who is a professor and licensed psychologist in the Department of Psychology at CSU. She has a research program investigating cognitive aging and community-based interventions for older adults. She is also the director of the Aging Center of the Rockies, Aging Clinic of the Rockies, and associate director of the Columbine Health Systems Center for Healthy Aging. Deanna?
Hi, everybody. Can you hear me okay?
Yep, we can hear you. Our next expert is Dr. Bob Ellis, who is a professor and the director of the Biosafety Office at CSU. He's responsible for establishing protocols for safety and security at Colorado State Research Laboratories that investigate bacteria, viruses, and other infectious agents with the aim of preventing, treating, and curing significant global diseases. Bob, can you say hello?
Yes, hi everybody, and I'm happy to be on this panel, and hopefully we can give you a lot of helpful information. Thanks for sending in your questions.
Our next panelist is Dr. Rebecca Jackson. She is a geriatric medicine specialist and medical director at Columbine Health Systems. Dr. Jackson completed her undergraduate degree in biology from CSU, her medical degree at Kirksville College of Osteopathic Medicine, a medical residency at the Family Medicine Center in Fort Collins, and a fellowship in geriatrics at Oregon Health Sciences University. Rebecca.
Hello, everyone. Thanks for having me today.
And last but certainly not least, we have Dr. Sue Schneider. She is an extension agent with Larimer County Office of CSU Extension. She provides leadership and programming in areas of community health and healthy aging, and is the director of Senior Access Points of Larimer County. Sue.
Hi, everybody. It's great to see so many wonderful faces and so many friendly, familiar faces as well.
All right, thank you. And without further delay, what I will do is move on to our first question. Again, we'll go through the questions that were submitted in advance first. And as you think of additional questions, please feel free to share those in the chat, and we will go over those additional questions at the end once we've covered the ones that were sent in advance. So our first question is about glove usage. What is the best practice for using gloves? When should I use them, and when are they not helpful at all?
So hi, everybody. So I'll take this first question. I think Dr. Ellis and I are going to tag team on this one. Gloves and masks are part of what we call personal protective equipment, or PPE, which is now part of our vernacular. That wasn't before. And you may have heard that we're trying to conserve as much PPE as possible for research, especially research centered around COVID-19. So when we're talking about mask usage and glove usage, we don't want to take away the PPE that is absolutely required to work with research around coronavirus. And so that's why we're really stressing the use of non-surgical, or these N95 masks, and really asking for people to use cloth masks. This is designed to make sure that we catch as many of those big droplets, and we're going to talk more about droplets later on in the conversation. Partner that with the 6 feet social distancing. And that is really something that can help protect people around you in case you have contracted coronavirus and maybe even don't know it yet. We know that there's a lot of people that don't show any symptoms but can spread the virus. In those scenarios, gloves really don't help you, right? The 6 foot distancing allows you to keep that distance so that you don't transfer any of the virus from your hands to other people. And gloves can often give you a false sense of security by wearing them for too long. If you wear them out at a store, for example, it's really no different than you not wearing gloves at all. If you touch something and then touch your face or something, it's as if you didn't have the gloves on at all. So they're really not effective, and they can often give you a false sense of security. One thing that both masks and gloves can do, though, is remind you not to touch your face while you're wearing those things. So that's really the only advantage of having gloves. But really, we're trying to recommend not wearing gloves to preserve that PPE for researchers. and to prevent that false sense of security that they might provide. And Bob, I don't know if you have additional information to add.
Yes, I would just like to say and reiterate what Mark went over as the main points. He really did hit the main points on PPE usage in this type of situation. The gloves, like he said, will definitely usually prevent you from touching your mouth, your face, your eyes, your nose, those types of things that are just inherent motions that we make all the time. There's always, seems like you get a little itch someplace, you want to scratch it, and that makes you move your hand to your face a lot of times. So if you've got gloves on, hopefully you would not be doing that. The other thing is, gloves do get dirty. Whatever they touch, a lot of times will stick to the gloves. So gloves are not bionic. They're not going to be destroying anything that sticks to them. You have to do that part. So in my opinion, it's better to not wear gloves unless they're absolutely necessary, and wash your hands frequently. Use hand sanitizers, do those kinds of things that we know will work. But by all means, do something to encourage yourself not to be touching your face with your hands.
Thank you very much. That actually, it segues very nicely into the next question, which is about hand sanitizer versus washing your hands. Which one is more effective, and how and when do you use each strategy?
Hi, me again. So I'm glad that Bob mentioned washing hands frequently, because that is a great way to reduce the amount of virus that you might be carrying on your hands. And to that end, hand washing is really good at removing things from your hands. And so just the act of removing superficial dirt that may contain virus on your hands works really, really well. If you don't have the ability to wash your hands with soap and water for 20 seconds, many of you may have told your children or grandchildren while they wash their hands to do the ABC song to make sure that they do it for at least 20 seconds. That's really, I think, the most effective way. And it's, using just normal soap and water that every household has. If that's not available, then I would recommend using some sort of hand sanitizer, which doesn't do that removal, that surfactant action as well as hand washing, but it can kill microorganisms like viruses on your hands. That is related to the amount of sanitizer you can use and the amount of contact time as well. So it's variable to the effectiveness of that. So if at all possible, soap and water for 20 seconds is preferred. In lieu of that, you can use hand sanitizer. Bob?
Yeah, and I'd agree again with what Mark said, and thanks for those comments, Mark. The hand sanitizers are not antibiotics in most cases. You really don't want to use hand sanitizers that have any antibiotics in them. What most of the hand sanitizers that I would recommend and other people would recommend have are 70% alcohol or higher base of alcohol. They have a little bit of a gel in to allow contact time. The contact time is definitely important. That's why you wash your hands for 20 seconds, because you're removing a lot of the layers of microbes that are on your hands, in your fingerprints, in your nails, and that mechanical washing gets rid of that. The hand sanitizer, on the other hand, has a contact time that helps it work. So that's why 68, 70% or higher content of alcohol will help destroy most bacteria and most viruses. It's not 100%, but it will definitely get the numbers down and be quite effective. So hand washing, if you can do it, use the hand sanitizers.
Thank you very much. And this next question actually also pertains to mask wearing. there's a lot of questions have come back about kind of types of masks. I know you talked about the N95 masks, which are the ones that people use in research and in medical communities when they're exposed to COVID. But then there, you know, the cloth masks, how tight should they be? And are bandanas or those buffs that people wear around their necks, are they as good as other kinds of masks? And also, how often do you wash or change your masks?
Okay, I'll start out on that one, and then Mark can maybe tag after me, or whoever else wants to. The difference between an N95 mask or N95 respirator, actually, they look like most of the other masks, but they are different. They have a different filter mechanism. They are able to filter out viruses and bacteria, whereas the cloth masks, the surgical masks, don't necessarily have that capacity. What they do is they slow down droplets for sure. They will stop a lot of droplets. That's why your face mask or surgical mask will get moist when you're breathing through it. And there can still be some escape, but what you want to do is, you know, we've seen on TV, especially during the last 2 months, people wearing masks that are totally inappropriate for the purpose, and they don't have them pulled over their nose. They're loose, they're baggy at the sides. They don't really do much from the standpoint of much filtering. They might filter direct particles, but they're not helping a lot. You should have a mask that fits you somewhat snugly, stays up over your nose, is not allowing all the air to just whoosh right out on the sides or up between your nose and the mask. So you want to try to get it to fit pretty well. That way you want most of your breath to go through the mask, not around it. And what the cloth masks will do, and if you have a few layers, about 3 layers maybe of a cloth mask, you can stop almost all the droplets that would be coming out of your mouth and your nose, but you wouldn't be able to stop all of the respiratory aerosols that would be coming out. And these are smaller than droplets. They might be just 1 bacteria at a time or a few viruses at a time, but still it will help to slow those down and help to keep those from going directly to some person. So combine that with the social distancing, the magical or maybe not so magical 6-foot spacing, that really helps the amount of exposure. And what we're dealing with here really is a numbers game. It's the exposure and the ability of that exposure to be a high enough concentration of whatever the infectious agent is. Here we're talking mostly about the SARS-2 virus that causes COVID-19 disease. But those two things together can really slow down the ability of that virus to travel from one person to another person and get into the respiratory system of that other person and possibly cause disease. So what we're doing is really trying to slow that whole process down.
Yes, and I agree with everything Bob has said. Again, this is a numbers game, and the larger the droplet, the more virus are going to be present in those droplets. And that mask helps to catch most of the large droplets, but it also helps to slow down the smaller droplets that are leaving our mouth and nose and may get through those cloth masks depending on the size of those droplets. But it does slow down that velocity. And that 6-foot distance is really determined by how far different sized droplets can travel. And most of them will fall out of the air within 6 feet and no longer be airborne. Now, if we're talking about aerosols, like Bob was saying, those are so light that they can often float and get caught by some air currents or wind and occasionally travel further distances. But they typically have far fewer virus associated with those aerosols. And again, wearing a mask helps to slow them down and limit the number of virus particles in the aerosols that are released. And I can't stress enough that the mask does have to fit over your nose and your mouth because, you know, if we cough and sneeze, we eliminate virus from both routes. So it's important to at least cover both your nose and your mouth.
I want to add one more thing real quickly here, and that is that if you're outdoors too, and there's doesn't even have to be much of a breeze that you can even feel, those aerosols that might go through your mask are immediately distributed. They don't stay as a bolus of aerosol that goes through your mask. They tend to break up and really get dispersed very quickly. So that's another reason for the mask over your face and nose and for the distancing.
If it's okay, I might add just a few things. I take care of patients in the long-term care setting, and we have definitely been dealing with COVID outbreaks with our residents. And I will say that the universal masking, I think, has been one of the key things that we've implemented that has prevented the spread. So just to kind of echo what they're saying, I think that mask is that barrier is effective, and it's really meant to protect the other person. So from you spreading it to another person potentially, because you do have this time period where you're pre-symptomatic, you're asymptomatic potentially, and those people may not know that they're shedding the virus. So it allows you to have that barrier to prevent it from spreading to other people, and it's been incredibly effective in our setting. So I would definitely encourage people to wear it, but keep it over your nose.
Thank you, Rebecca. One other thing I forgot to address, the other part of that question is how often should you change masks? Can you reuse masks? The good thing about the cloth masks are you can wash them and then reuse them. We recommend that you have at least 2 masks so that you can wear one day and then switch it out the next day and wash the other one, let it dry, and then switch that again the following day after that. So if you can find 2 cloth masks, that's optimal. If not, you might just have to wash your mask and let it dry before you use it again.
Thank you. That was awesome. Okay, the next question is, how should volunteers who want to work with older adults be tested for COVID? Is there any availability? Is just a temperature check valid? And should the volunteer's insurance pay for it?
A good question, and a very popular question lately. So I think the thing to know about testing is that it's really just provides you a snapshot in time. So there is a lot of discussion, especially in nursing homes, about how we are going to protect our vulnerable elders, because it's usually the staff that will bring it into the building. So really, because it is only a snapshot on time, you would need very frequent testing. So like they're suggesting right now for us, once a week, potentially for all residents and staff. So which is going to be very complicated for them to execute. And we really don't have the testing availability for that. So what I would say is that, you know, they have all these recommendations about monitoring temperature, and we do temperature screenings routinely. You know, if you have a temperature of 100 or greater, I mean, that might be something if you are going to be going to someone's home just to check your temperature at home, make sure that it's within a normal range. And then, of course, if you are developing any symptoms, such as, you know, the cough, shortness of breath, the other major symptoms that they've been attributed to this, I mean, there's things such as like just even a loss of taste and smell, runny nose, those kind of symptoms that you might avoid going in to see someone. And of course, you could have something else besides COVID that you could spread to the people that you're working with. So I do think the temperature and symptom monitoring is probably going to be the best way if you're going to be volunteering and working with older adults. Certainly, I mean, it changed actually today, because I actually looked at UC Health to see if they are testing asymptomatic individuals, and yesterday they weren't, but it looks like they may be doing that now. I know that they are starting to provide antibody testing as well, so you can register through that UC Health. They're trying to expand their testing capabilities. The antibody testing just tells you if you were potentially exposed. It doesn't really tell you if you have an active infection. So it's a little bit different, but it looks like they are trying to expand that within Colorado quite a bit. But right now, I'm not sure if you're asymptomatic, if they would allow you to come in and get tested. So that would be something you'd have to ask through your regular healthcare provider.
Thank you, Dr. Jackson.
Yeah.
This other question talks about mixed messaging, and I know that's been a real frustrating dilemma for most people as we try to navigate this whole landscape. So the question is, if we get mixed messages from multiple organizations, who do we go with? The Larimer County Health Department, the Governor's Office, the CDC, and what sources should families look to get good information, or what sources should be avoided, even more importantly? Bob, I think you were going to.
Yeah.
Okay. Great.
I'll jump in on that one. I really think the best information that we're getting and the most consistent information, and also information that's updated with the latest new information, is from CDC. And that does not come out daily. It comes out every few days, but they do keep updating things on their website. And the really important thing is there that they are taking a cross-section of all the information throughout the US and trying to update their recommendations from that standpoint. Then you would drop down from there to the states, and from the states to the counties. So even if CDC, what CDC would say is a broader range recommendation most usually, but you still need to be very cognizant of what is going on in your county and in your state. And if some of the other colleagues on here can chime in on that, that would be really helpful. But that's where I would say, above all, your high school and college classmates that failed every biology class they took and didn't ever take any microbiology class, that's probably the last person you want to take advice from.
Anybody else who wants to comment? Rebecca?
Yeah, we were just talking to, when we were talking about preparing for this session, is that, social media really isn't, I mean, I think I saw something, and I saw it on New York Times, who knows if that's real too, but like, they were saying that half of the stuff that's being posted about the coronavirus is probably inaccurate or by bots. So you have to be really cautious when you're looking at social media information. I do think the CDC has a great website with a ton of guidance on different elements that, if you have different questions about health, like childcare, different things, they even have like a symptom checker on there, which is really helpful. You get a lot of good data from the CDPHE. They've been a wonderful resource for us. I can't say enough about them. And then the local Larimer County Health Department has been wonderful, because it doesn't really vary from county to county what some of the restrictions that they're doing, and especially with the reopening phase. So looking in your local county is also really helpful.
One of the things that I want to pop back in with a little bit of humor here too is that this is not humorous. There are scores of coronaviruses. So the one that we're talking about mostly that on this program that causes COVID-19, that's just one of many, many, many viruses that are of the overall family coronavirus. And about 6 weeks ago, somebody posted on Facebook, what do you mean there's no vaccine? Here's a vaccine that's been available since the mid-90s. And they showed a picture of a coronavirus vaccine, canine coronavirus. And it was one of my relatives that posted it, and they were definitely posting it in jest. And I wrote back and said, yeah, this will work if you're a dog, and if your veterinarian will administer it to you. But if you're looking for protection from the COVID-19 disease by SARS-2, this is not the virus or the vaccine that's going to do you any good at all. So the vaccine that's being worked on is very specific for this particular virus, and it has to be in order for it to work.
Great point, Bob. Thank you. The next question is about social isolation. How can we help with social isolation and loneliness problems while keeping older adults safe?
So I'm happy to start with that one. I think one of the things that's really important that shifted fairly quickly with the social distancing was that we probably really should have called it physical distancing from the get-go, because people still need to be having social interactions. And one of my concerns at the aging clinic that I hear is that there are folks who are saying, well, I don't really want to try the video calls to people, or I don't want to try telehealth. I just kind of want to wait for this to be over, and then reconnect with people. And given that older adults are consistently viewed as the higher risk group, I think it's really important that we are very vigilant about people who may be falling through the cracks or may not be getting sufficient social interaction. And I come in as a psychologist, but I think the social interaction is probably equally as important as what they're putting in their mouth to eat and what they're doing every day. And I think for some people, this has been a bit of a problem in terms of not really knowing where to go or what to do. And so the default is to maybe stay away from older adults, or to wait until this goes away to start interacting normally again. And I would just really encourage anyone that has interactions with older adults that you start using some of the resources that are out there. One of the nice things about this pandemic is that there's been a lot of money poured into resources to allow people who may be stuck at home to do more virtual things with their families. There's free software, so even if you can't physically be with your family, you could go online and play Pictionary with them. There are agencies in town that are funding all sorts of social online groups for older adults. I just really think that when people are planning sort of their day-to-day and how they're going to respond to this pandemic, part of that schedule needs to be, what are the social interactions going to be like? And even though it's going to be a person-to-person basis in terms of if there's other health complications, if you have family or friends around, I think starting to pursue some of those other avenues, like doing texts or phone calls or checking out some of the video options, I would just really encourage people to start sampling those while we have sort of a captive audience and people willing to help older adults get adjusted to new types of technology, or while there are free services available to people to kind of get them engaged.
Thank you. The next question actually is very related to this one, so that was super helpful. What are some signs that a loved one might be struggling emotionally with COVID or isolation, and how can we identify the people that need help?
That's a really good question. I think people who have people in their lives will be the ones that we recognize that there's a problem. I think people who are isolated is our biggest concern, is that there are people who don't have regular interactions with family and friends, and that they may be more likely to kind of fall through the cracks. In terms of your loved ones, I mean, I think you look for some of the early signs that you might see with depression or anxiety if you're talking to somebody. Even if they can't necessarily put their finger on it, that they're feeling socially isolated, sometimes they'll present with, I haven't been sleeping as well, or I'm just not as hungry, or I don't really feel like doing things anymore. Sometimes we see more agitation. So people may feel sort of irritable, like they aren't managing stressors as well. I think that's pretty normal, but if they really feel like things are out of their control and they're not getting a lot of support, I think you want to watch for anything that suggests that they're not doing very well in terms of just day-to-day routines, eating, sleeping, getting up in the morning and being motivated to do things. And then again, looking for sort of agitation signs. I think you want to be really careful. We've already sort of touched on it, but sometimes what happens, unfortunately, is that people who may be more isolated or alone may be spending way too much time watching the news, or just sort of having a constant diet of fear. And so I think it's really important too, if you have somebody that you're concerned about, that you're talking about what does your day look like and what kind of things are you doing during the day. And some of those need to be pro-social. And whether or not it's in person, I think part of that is up to families and part of that has to do with the risk factors, but it doesn't have to even be in person. I think everybody should, again, be sort of, if you're catching some of those symptoms, really making sure that you're connecting with that person on a day-to-day basis and that they're finding adaptive ways to improve their situation rather than if you're noticing it's getting worse and worse over time.
I have a question. My name is Angelina.
Hi, Angelina.
Hi. I'm wondering, are we talking 12 to 18 months before we can interact with our senior friends?
You know, I will have to get Dr. Jackson to jump in here too. I mean, my understanding is it kind of will depend on health factors and risk factors, but I would say that in terms of in-person, I think what we're shooting for is people being able to respect physical distancing and potentially having to use masks or having some protective gear. But I'm hoping that you could have some sort of social interaction. It won't be the same social interaction, and I think we have to respect all of these safety issues. So I would say for normal social interaction, there's a possibility 12 to 18 months, but I would like to hear what Dr. Jackson thinks about other types.
I wish I had a crystal ball. I can't even predict next week right now. So, but yeah, I mean, I think a lot will probably depend on like how widespread the community spread is too. So, you know, like Larimer County, we've been pretty fortunate. It hasn't been really severe here versus other areas, like the more dense urban areas where it's a lot worse. So I think in the future they might, you know, I could see us living in this like kind of like in post 9/11 where we have level like red, you're going to be social distancing more versus orange versus yellow kind of thing. I can see that potentially happening someday. What I'm hopeful though is that people can be out with other, because I mean, I think what COVID's exposed to me is how, I mean, like we're humans and we're meant to be with each other. And I don't, like it's been a struggle watching my residents be away from their families. So we have to figure out how we're going to function with this if there is not a good vaccine that comes out. You know, on the way in today, and NPR was listening to a woman who's talking about how they've made their bubble and they have their 6 friends who are all isolating at home, and they feel like they can go and have their little social interactions with them, and that provides them that that interaction that they need, so they don't feel like they have to go to a movie theater or something like that in the future, but they can have their little bubble where they know that these people have been taking the precautions and they're staying safe, and that they feel like they can be with them. So I think we're going to have to figure out workarounds in the future, because if we are in this for the next year at least, it's just too long to be away from each other and not be with the people that you care about. So I don't know if that, hopefully that helps answer a little bit.
Thank
Not
you.
a good answer.
Thank you. Wow, really thoughtful. Thank you. This next question is about food, and why, the question is, why are seniors more vulnerable to foodborne illness?
All right. Well, we know that seniors or older adults are more vulnerable, and this information comes from, you know, past outbreaks where we've identified higher risk audiences, and seniors are one of those groups. And not only are they more vulnerable, but they're more likely to experience more severe symptoms as well. So, and the reason this question becomes important now is that it's always a good idea to avoid foodborne illness, but it's especially a good idea to avoid it now, because you don't want to have to seek medical care, you know, during these times. You want to stay, you know, away from that if at all possible. But there are many contributing factors to this, and some of them are pretty general, like just a reduction in the strength of the immune system, but also digestion rates slow as you age, and the stomach environment is less acidic. So these things contribute, you know, and as far as factors during digestion, but also the liver and kidneys may not be functioning as optimally as you age, and then there's just other, greater likelihood of malnutrition or chronic illness or underlying conditions. So several different factors contribute to this, but really the key point is that older adults need to be aware that they're more vulnerable, and that following good food safety practices is really the best course of action.
Thank you. That actually leads really well into the next question, which is, I really enjoy eating fresh salads, but is it safe to buy produce that is not packaged, like loose leaf lettuce or apples?
Well, I really enjoy answering this question because I like to steer people back toward that fresh produce. And the good news is that both CDC and FDA have released statements that there has not been evidence that points to food or food packaging as playing a significant role in spreading the virus. So, but it's still wise to take precautions when handling fresh produce at really, at all times, not just now. And it's important because fruits and vegetables are such an essential part of a healthy diet. So some of the things that we would suggest is that still buying, especially, leafy greens and lots of a wide variety of different types of produce, but you can avoid touching loose produce by just using the bags that are available in the produce section to pick up that loose leaf lettuce or apples, or an alternative is just to look for produce that's already in bags, like many of the different types of salad greens are these days. So you could avoid doing that, but then just follow some of the basic food or shopping recommendations that are being given right now, and that is to use hand sanitizer before entering the store, to wash your hands well after returning home or after putting away your groceries, and and then and as always, to really rinse produce well before preparing or consuming it. And in terms of making salads, that can mean using a salad spinner or even a colander or a strainer, anything that can help really rinse off fresh produce well before you consume it.
Thank you very much. This next question is about people in assisted living facilities, but also about prepared food. So the question is, my mother-in-law is in an assisted living facility and meal trays are being delivered to her room since the dining hall is closed. What precautions do seniors need to take with prepared food that is delivered to them?
Well, probably the most important thing to remember is the 2-hour rule. And that would be to consume or to refrigerate that food within 2 hours, and the shorter the time, the better. And then if it's a situation where you can refrigerate it and keep it as leftovers, then it's a really good idea to date leftovers, because it's recommended to consume those within 3 or 4 days, and it can be hard to remember exactly how many days leftovers have been in the refrigerator. Also important just to follow back to the same good food safety practices, and that reheating leftovers to the recommended temperature, and having a food thermometer available so you can know for sure that they have reached that 165 temperature, and just make sure that your refrigerator is set at a proper temperature. I think that kind of sums that up.
Yeah, that's really great. And the only, for our facilities, what we're recommending too is that our residents also use hand sanitizer prior to consuming their meals. So just if there is that, or doing basic hand hygiene. So the staff really, the state is regulating these facilities and watching and really encouraging good hand hygiene practices for the staff. And then we just are also recommending that they do that before they consume their meal as well.
Thank you. This next question is about nutrition, and the question is pertaining to people that are relying on food banks or other deliveries free food sources to supplement their pantries because of their limited income. And sometimes these people have many children in their homes. The question pertains to the type of nutritional value that the food they receive contains. So there are things like day-old donuts or cakes or boxed pasta, but not always the most nutritionally dense food that supports the diet, a good diet for them and the children. Are there resources that can help keep families in good nutrition or help them learn more about good nutrition?
Do you want to start on that one?
Sure. I mean, I would refer people to CSU Extension. We have a lot of nutrition specialists that continually add to our website. You can Google CSU Extension. We've also put together, Extension's put together a COVID-19 resource page that's trying to support folks on a statewide level. And there's a nutrition link there with a lot of really great resources. I'll post that on the chat for you. In terms of food assistance, you know, there are a lot of great programs out there. The United Way can help assist people in finding the right kind of food assistance. You can call 211 for that. And then, you know, a little off the topic, but there's a lot of food delivery support programs for folks who can't get to the store, aren't ready to get to the store. There are a lot of great links and information on the Senior Access Points website. You can go to larimerseniors.org and see all of those opportunities for food delivery, food assistance, and those are in Larimer County. But again, if you're looking at a different county, I'll put on chat the CSU Extension COVID-19 resource page, and it's got a lot of great nutrition links for you.
And the only thing I'd add is a kind of a basic guideline to go with for a healthy diet is variety, balance, and moderation. So if the food that's coming your way doesn't have that, you may just want to try and shift things. So finding a way to add in fruits and vegetables if that's not part of the mix. And I would say, you know, if life gives you pasta, then think of things like pasta salad with lots of vegetables added, or Mediterranean pasta with tomato sauce, and you know, just trying to incorporate more healthy foods along with you know, whatever is available.
Thank you. What about seniors that care for school-age children? And there's a concern as they go back to school. What kind of risks do we have? How do we protect ourselves as seniors that are caring for school-age children, and also maybe in public spaces?
I think this is that's going to be it's a hard question. I think it'll be interesting to see how the schools reopen in the fall. So that, I mean, I'm assuming it's kind of like the daycares now are very limited to how many kids can come back to help provide some of that physical distancing. You know, I think if there is a senior living in the home with a family, you know, if the family can maintain as much of the recommended precautions as possible when they leave the home to protect themselves, with, you know, the masking, hand hygiene, those kind of things. And it's really hard with kids. I mean, I have a 4-year-old and a 7-year-old, and they bring home everything from school. So it's going to be interesting to see how the schools are, you know, I think they're going to be charged with how they're going to be wiping down those high touch surfaces, distancing kids as best as they can. So, but I would think that if you have people living in the home, if they can maintain those precautions as best as they can, and hopefully we'll know more as the fall approaches and the schools are getting more guidance from the state, what those are going to look like.
Yeah, thanks, Rebecca. I'm surprised you've been able to remain so healthy with a 4-year-old and a 7-year-old. They're little petri dishes at that age.
They are.
So I just would reiterate what Rebecca just said. In these instances where seniors are primary caregivers to young children, their grandchildren, you really have to approach it as if you are a healthcare worker, and you need to take precautions to protect yourself from anything that your grandchildren might bring home. So that likely means you have to practice mask wearing more often. Again, I can't emphasize enough, you have to keep washing not just your hands, but your grandchildren's hands. Remind them. You can have a hand washing party and sing the ABC songs together, but you're likely going to want to try and wear that mask more often, more frequently when you're interacting with those kids, and just take additional precautions. There has been some emerging evidence that there's not as much transmission through surfaces, but that doesn't mean it's not possible. I am an infectious disease researcher, and I still would recommend, again, decontaminating kitchen counters, bathroom counters as often as possible, whenever you use them, and then at the end of the day. So really just kind of approach it as if you were a healthcare worker in a clinic or a hospital setting, and your grandchildren are your patients.
Thank you very much. Sue,
And
did you- yeah.
Nope, I just want to point out something because I see that Gail Engel is on here with the Grand Family Coalition, and I know we have a number of grandparents that have put questions in. In Larimer County, we have this great organization, Grand Family Coalition. I'm gonna, hopefully it's okay with Gail, I'm gonna put their website up here on the chat box as well, because they're on the front lines. They know what's happening with grand families, and they know what some of the best ways to connect and support and to provide that support are. So I'll post that in the chat.
Did you want to comment? I don't want to put you on the spot, Gail, but if you had a comment, we'd welcome it.
No, I don't really have a comment. Thank you, Sue. Yes, those are some of my questions, and we are very concerned because we do have older adults who are raising children, and those little petri dishes are living with us, and we are very concerned about them going back to school, and we really don't know how to protect ourselves. And many of our grandparents are up to age 86 raising children, and so it's a difficult situation. And I was also the one who asked about the food insecurities, and we have to understand that many of these grandparents are also living on a very limited income, and they rely on the food banks to provide their nutrition for them and those children. So that's mainly my interest, is helping everybody understand there's a group of people that this is a very difficult time for them.
Thank you so much. I really appreciate those comments and just bringing that to everyone's awareness, because I understand what a tough time this is. And we'll do our best to try to get you the information that will help with that, as the experts kind of continue to sort through what's coming out in the science literature. We are getting a little close on time, so I wanted to skip to one question here that I think, well, two that I think will be really important for this group. The first is a question about vaccines. When do you think a vaccine will be available? And do we all have to stay isolated until then? How can we begin to try to get back to normal safely without a vaccine?
Yeah, that's a really important question. And I would say that, the fastest we've ever developed a safe vaccine for large dissemination is around 4 years. And that's a realistic timeline. Now, it's a little bit different for this coronavirus because we're pushing out a lot of different vaccine trials simultaneously. We hope that that is going to expedite discovery of an effective vaccine, but we have no real way of knowing which vaccine is going to be effective. And I guarantee you the vast majority of them are not going to be effective. So we can't obviously wait around for 4 years before we reintroduce ourselves into the public, but that's what makes these social distancing and mask wearing and hand washing in the short term so vitally important, is because that's our best way to limit the spread of the virus until we do start developing herd immunity and an effective vaccine. Now, what we don't want to do is develop herd immunity by just allowing the virus to spread unchecked through the population. That comes with a lot of death, as we've already seen. And that is not an effective strategy for developing herd immunity. So what we're going to see, I would predict we're going to see a waxing and waning of the virus. We can already see, I think South Korea just today announced that they were kind of reverting back to some self-isolation, some social distancing based on resurgence of the virus. Again, testing is going to be key to that as well. If we can get on top of new emerging outbreaks and address them quickly with a social distancing policy, that's going to help contain any new outbreaks that we do see while we try to find an effective vaccine. So we're going to have to continue these more generic, broad exercises while researchers do find a vaccine. And I will predict, though, that this a coronavirus vaccine will be developed, and it will be probably developed in the shortest amount of time we've ever seen, simply because of the vast number of vaccines, the amount of money, research, time, and effort being put into finding one. I am confident that we're going to do it, but it, you know, I don't want to speculate on how many years, but I will bet you guys a beer it's going to be less than 4.
Thank you, Mark. That was helpful. So that does get to like the question about how, so if we can implement some of these things such as mask wearing, how safe, for example, is outdoor exercise versus indoor exercise, and group exercise versus individuals? Like where do you draw the line for example, seniors to be able to continue to move and get their exercise, which is so vitally important, but also keep themselves safe?
I think there are a lot of opportunities for being outdoors. I would say that for seniors, and I'm in that group, that we can find all kinds of things. I don't see it happening as in the Fort Collins Senior Center, for example. I don't see that happening anytime real soon, or if it does, it's going to be really, really limited. But just walking outdoors, walking around the neighborhood. If you're in a house that's got stairs, up and down the stairs, that'll get your heart rate up. And all kinds of things like that, where you can keep moving, keep active. If you ride bicycles, ride your bicycles. And one of the things that I've noticed by our home, we live right on the Spring Creek Trail, just barely west of Taft Hill, right at pretty much the corner of Drake and Taft Hill here in Fort Collins. The trail, the Spring Creek Trail, is busy. It's a real thoroughfare out there. And you see most people now are wearing masks, but still some aren't. My wife and I don't choose to go there. We choose to go just around the neighborhood or out to some of the natural areas in the evenings where the number of people out there is less. If you don't have a dog so that you're not worried about where you're going to walk your dog, there are some natural areas that don't allow dogs. That cuts down on the population of people there too. So choose some of those areas, but there are many, many, many areas where you can get out and do those kinds of things. Also find ways to do other exercises at home, all kinds of things that you can do to help move your muscles in ways that are weight bearing. So look for ways to do that. Don't just sit around wishing the senior center or whatever was open. Find a way to get past that hurdle.
Thank you very much. I know that we're at the top of the hour and there were a lot of excellent questions that came up in the chat. Luckily, our wonderful panel has been kind of answering them by text in the message section or in the chat section. So if you would like to sort of visit some of those answers, pretty much everything that was asked has been addressed about car travel, restaurants, and then some websites that are going to be very helpful for resources. So I'm seeing pretty much all the questions that were up there having been answered, luckily, because we're now out of time. So I do want very much to thank our experts again for sharing their knowledge and their time with us today. And I'd also like to share a couple of folks that have been in the background that have really helped with providing this opportunity to all of you. Allie Murphy, the admin assistant at the Center for Healthy Aging, Jim Becker, who is with Senior Access Points, and I just lost it. That's terrible. Partnerships for Age-Friendly Community. Thank you. And then Karen Hamilton, our Associate Director of the Center for Healthy Aging. Thank you all. And just a reminder that the recording of this webinar will be available for viewing tomorrow, and we'll send this link to all of you who have registered, but we'll also make it available on our center website. And then any of our community partners who have participated in this call, you're more than welcome to share this link with whomever you feel would benefit from it. So we'd love to hear your feedback on this, either in the chat or by email. Please let us know what you thought and how we can best help you moving forward with something similar in the future. Thank you, everybody. We really appreciate it.